All right, Krystal, what's on your radar?
Well, yesterday, while filming our show, we received word of another massive gut punch to American workers. New unemployment claims last week were 6.6 million. Add that on top of the 3.3 million who lost their jobs and filed the week before, and you're looking at 10 million Americans out of a job in 2 weeks. And the sad part is, we all know this is just the beginning. With unemployment systems crashing, many have struggled to enroll, and many more are being laid off every day. This is obviously terrible news on its own, but it's made even worse by the fact that many of those millions are not only losing their job, but the health care that by accident of history is tied to employment in America. But I'm sure that having no health care coverage is fine in the middle of a pandemic, no problem, right? Can we all just admit that the entire healthcare debate we've been having throughout this primary, and really for years, has been stupid, immoral, and completely corporate-driven? We were stuffed so full of industry talking points that they infiltrated the policy of every media question, every debate, and even the rhetoric of supposed progressives. Medicare for those who want it, public option, how will you pay for it? As our hospital system buckles, Americans quarantine, and thousands die, the debate over universal health care versus the current mess is over. Finished. As Kianga Yamata Taylor wrote in a piece with the great title, "Reality Has Endorsed Bernie Sanders," healthcare inequalities are problems that have been left unattended, creating so many small, imperceptible fractures that in the midst of a full-scale crisis, the structure is collapsing, shattering under its own weight. This is becoming increasingly clear to a majority of Americans, in spite of being pummeled with incessant industry rhetoric about the horrors and extremism of Medicare for All, a policy position that we were promised was a guaranteed general election loser and which would doom the left and the Democratic Party to eternal irrelevancy. Americans can now see its value quite clearly. A majority of them tell pollsters that if Medicare for All is a radical initiative, well, then just call them Saul Alinsky. According to a new Morning Consult poll, net favorability for the policy has jumped 9 points in the past month alone, and it's now supported by 55% of the public, including a majority of independents. But there's one very prominent and rather significant hold down on that policy. That would be anointed Democratic leader Joe Biden. You'll recall that in early March, Joe indicated to Lawrence O'Donnell that he would likely veto Medicare for All if it did come to his desk.
Let's flash forward. Your president, Bernie Sanders, is still active in the Senate. He manages to get Medicare for All through the Senate in some compromised version, the Elizabeth Warren version or other version. Nancy Pelosi gets a version of it through the House of Representatives. It comes to your desk. Do you veto it?
I would veto anything that delays providing the security and the certainty of health care being available now. If they got that through and by some miracle, there was an epiphany that occurred, and some miracle occurred that said, okay, it's passed, then you got to look at the cost. I want to know, how did they find the $35 trillion? What is that doing? Is it going to significantly raise taxes on the middle class, which it will? What's going to happen? Look, my opposition isn't to the principle that you should have Medicare. I mean, everybody, health care should be a right in America. My opposition relates to whether or not, A, it's doable, two, what the cost is, and what the consequences for the rest of the budget are. How are you going to find $35 trillion over the next 10 years?
And of course, in the last debate, one-on-one against Bernie Sanders, Joe derided the Italian single-payer system in a quote that could have been straight from Fox News or even Ben Shapiro.
And with all due respect to Medicare for All, you have a single-payer system in Italy. It doesn't work there. It has nothing to do with Medicare for All. That would not solve the problem at all. We can take care of that right now by making sure that no one has to pay for treatment, period, because of the crisis. No one has to pay for whatever drugs are needed, period, because of the crisis. No one has to pay for hospitalization because of the crisis, period. That is a national emergency, and that's how it's handled. It is not working in Italy right now, and they have a single-payer system.
But I do want to be fair here. That was more than 2 weeks ago, and in the ensuing time, our entire world seems to have come unglued. So surely, as Biden has watched millions lose their health insurance and thousands die and support for Medicare for All surge, and industry estimates saying that premiums could surge 40% next year, surely he would have reconsidered just a smidge as the stark and cruel reality sets in. Well, apparently not. In a press live stream yesterday, Joe had this to say.
If you had the Medicare for All option now, It still has to be implemented by the federal government. Look, here's the point. The idea that this would have stopped the virus from occurring, the idea it would have been able to be implemented earlier, the idea it would have fundamentally changed anything is just not accurate.
Well, of course, universal health care wouldn't stop the virus from occurring. But if you think that it wouldn't make a massive difference for Americans to have confidence that they could get testing and treatment, then you're either insane or completely bought off. Coronavirus treatment will bankrupt the uninsured, costing around $35,000 if they even go to seek that treatment. We know, of course, that many will stay home when they should go to the hospital just to try to avoid medical bankruptcy and financial oblivion. But not once did candidates get asked, how will we pay for it, about those who are socked with thousands and thousands of dollars in medical expenses with no ability to pay. For millions of Americans, the only answer is to pray they don't get sick. An uninsured mother of 3 in California told McClatchy that if someone in her house were to get coronavirus, imagine, she says, I would have no idea what to do. Honestly, I don't. Now, I'm not a presidential candidate or anything, but it seems to me that if this mom and millions more like her knew they wouldn't pay a dime for care, that would be a pretty fundamental change indeed. But I guess it's too much to ask and very toxic and selfish of me to expect that a Democratic frontrunner who mouths the words healthcare is a right would actually embrace that principle. Luckily for them, they don't seem to think they need those of us who actually believe in healthcare as a right anyway. Sagar, it's just incredible the way that even as millions lose their health care coverage, because what did we hear about Medicare for All? We heard this talking point again and again about how it would be so unfair because you'd kick Americans off of their health insurance. Millions of people are getting kicked off their health insurance as we speak, and yet that doesn't seem to set in or change Joe's talking points at all.
Right, and the other thing is, you didn't even mention the political dynamic, which we've covered here, which is he's holding the line against this despite the fact, look, all the polling that we know shows that the Democratic primary faithful think healthcare is their number one issue. And of that, the vast majority of them agree with Medicare for all and believe they trust Bernie Sanders most on the healthcare issue. This is purely political. So from that perspective, if your entire goal right now is to unite that party, bring it up against Donald Trump, and say that you need to increase fundamentally what was the problem with Hillary Clinton. It was a voter turnout issue of the people who had voted in the past for Democrats, not even necessarily people who were Obama-Trump flipovers. If she had just turned out enough of traditional Democratic faithful, would have won the election. How are you going to do that if you're not inspiring a message which is the core to so many of these voters?
Right.
Just literally, this is just from a political perspective. So railing against it seems much more, again, to go in the direction of what we've talked about, is that he's trying to consolidate that Democratic Party around the maybe 25% who never wanted Medicare for all, and that's the suburban voters. Those are the voters that came out in droves in 2018, and that the media has really fetishized as the new Democratic Party.
Right.
And them allied with Wall Street.
Yeah.
That is really what he wants, is to represent that constituency to its core, because he believes that driving them out will be key to his success. But he's forgetting about a whole other chunk of people that Hillary Clinton forgot about too.
Right, and their plan is twofold. On the one hand, you hear from Jennifer Rubin, and you're going to hear this more and more, as I argued yesterday, that, oh, you don't need those Bernie Sanders people, like, that support Medicare for all. You don't need them. Don't worry about them. There's plenty of us never Trump Republicans to make up the gap, right? Which is obviously foolish, but it provides them this benefit, which is that if they don't try to appeal for Bernie Sanders supporters and supporters of Medicare for all, and those people either stay home or some of them vote for another candidate, then they get off the hook again. They can just blame those people again. So it gives them an out, because the worst fear for them is that Donald Trump wins again and they actually take the blame this time, that their hollow lack of any kind of vision, the policies that have been so detrimental to the working class, is finally really exposed in a way that Americans wholesale reject. But as long as they get to blame Bernie Sanders people, then no problem. It's all their fault. It's all Bernie's fault. And you already see them laying the groundwork for that. The other strategy is not to try to appeal to them on their values. Look, if I really believed that Joe Biden was going to fight for Medicare for all and a Green New Deal, I would back, no problem. Like, it's not a personal thing. I believe in the policies. That's the issue. And so they think that rather than trying to appeal to Sanders supporters on the issues and build some trust there, that they can just shame them into coming on board. It doesn't work. In fact, it usually has the opposite effect. That's part of what the Democratic strategy was against Donald Trump last time around. Shame voters into voting for Hillary Clinton. And, you know, some percentage of them would tell pollsters that they were supporting Hillary Clinton. And then when they went in the ballot box, they voted for Donald Trump.
And they would say,
out of spite.
And they would say, the media told me to hate Trump so much, and that's why I voted for him. It's like that woman that we played here. It's because of MSNBC that I'm going to vote for Bernie Sanders because of your outrageous treatment of him. People do not like to take their signals from corporate oligarch overlords or the Democratic establishment. And that's what you mentioned. It's not just Bernie supporters. People who support Bernie Sanders or any candidate do not support them simply because of their name, or maybe some, but a very few amount. It's about the actual policies that animate somebody in order to back that person. So whenever you're saying he's alienating Bernie supporters, I don't even think it's just Bernie supporters.
Right.
I think it's all of the Democratic faithful who believe, at least in the polling, say that they have a high affinity for this man, and they have a high affinity for this man for one simple reason, because of his position on health care. So whenever you're not speaking to their chief concern as a citizen, then that's a very dangerous political thing to do. And yet, I don't know. I'm not even, I'm not like a Biden supporter or anything, but I'm like, how do you not understand this?
Right.
Like, how do you not just look at that data and be like, this is what I need to do in order to win the election?
And I don't think they're looking at the data, because I think they have it so ingrained in their head that Medicare for All is this radical, terrible position that'll cause you to lose the election, that they can't see that actually it has a majority support, not just among Democrats, among all voters right now, among independents. It's a majority support position. So it tells you how invulnerable to data they are, and also just how wrong-headed they are in how they think about politics and the way that they approach it. They put this certain group of policies into the extreme and radical bucket. They assume that nobody supports them, and then they just go with that regardless of what the polls say, regardless of what the data says, and honestly also regardless of what the actual right moral position is too.
And that's what happened. I mean, I saw this on the right too. People were like, oh, well, we need more Border Patrol guards. And Trump was like, I'm going to build a wall. And everyone was like, wait, what? And then guess what? The majoritarian position in the entire party. It seemed radical, and yet everybody supported it, and he ended up winning the election. So maybe take a page out of that book.
Could be. All right, Sagar, looking forward to your radar. That's next.